Earle, and it's Hump Day with Dr. Earle. We're here at Pure Plastic Surgery, and this is the time where I get to spend with you guys and answer all of your plastic surgery questions and go over plastic surgery topics. And once again, you know this is coming from a reliable source because I am a double board certified plastic surgeon, Duke trained, Ivy League educated, 12 plus years of experience, thousands of cases under my belt, etc., etc., etc. Okay, so today we're going to kick it off a little bit old school. So today we're just going to dive into the questions, all right? I know you guys like me to do this every once in a while, so today it's just going to be all about you and answering your questions about anything related to plastic surgery. It can be about the procedures, it can be about pre-op, post-op, any plastic surgery procedure you can think of from head to toe, okay? But the first question I'm going to answer that we're going to talk about is one that a follower sent to me via DM, which is, are you able to get pregnant after a BBL? And, you know, of course, if you do get pregnant after a BBL, you know, what happens? What are the consequences there? So, well, the first answer to the question is yes. I mean, you are able to get pregnant after BBL. And so, of course, you want to be careful. I mean, if that's what you're looking for, then that's great. But you want to, you know, avoid any potential, you know, accident or things like that, if that's not really what you're looking for, right? Because will pregnancy affect your BBL results? It certainly can, right? So whenever someone is, you know, pregnant, there's going to be, of course, changes in the body, changes in the hormones, changes in your overall weight, okay? And all these things could potentially affect your BBL results. So what is it that I tell my patients that, you know, for whatever reason do happen to get pregnant after the BBL? Well, there are things that you can do to try to minimize the impact of the pregnancy on the BBL, okay? And these are things that you probably should be doing anyways, which is to have a healthy pregnancy, right? And so certainly when you become pregnant, there's going to be some degree of increase in weight, and that's good and that's healthy. But you don't want to, at the same time, you don't want to overdo it, right? So you just want to gain just enough weight that is necessary to have a healthy pregnancy, but you don't want to go overboard, okay? And then the other thing that you can do is to keep yourself active during the pregnancy. So, you know, going to the gym, continue to do that, you know, working out. If you are a person that likes to do walks, you know, continue walking, light jogging, things like that. Of course, always check in with your OB, always check in, you know, make sure that whatever you're doing is okay by them, right? But I'm saying, you know, for most kind of run-of-the-mill regular pregnancies where everything's going okay, you can be pretty active pretty much up until like the last day or the last week, right? So if you do all that, then I have seen many of our patients, they bounce back well from the pregnancy and their body bounces back pretty well, and they're able to go back to that same kind of shape that was given, you know, with the BBL. So going back to that, you know, that kind of Earle curve, signature upside down heart shape, and things like that. So what does, you know, a lot of times change is not so much the shape or the silhouette, but it's the skin issue, right? So you may still have some loose skin, especially in the lower belly area. You may have some weakness of your abdominal wall or separation of the muscles due to the pregnancy. So sometimes what happens is that after you do your BBL, then you have your baby, a lot of patients, they don't need another BBL, but what they do need then is a tummy tuck, okay? So that's kind of like everything that has to do with that in a nutshell, but I'm happy to answer any questions regarding that or anything else.
How long should someone wait to get pregnant after the BBL?
So how long should you wait? Well, I'll tell you, you definitely want to wait at least, I say at the very least, 3 months, okay? Because your body isn't even fully healed before then. I mean, I always tell all my patients that you can't expect to see your final result after a BBL between somewhere between 3 to 6 months. So if you become pregnant within the first 3 months, then you're gonna have, your body's gonna be going through changes of the pregnancy while at the same time it hasn't fully healed, recovered, or settled from the BBL. All right, so definitely not before 3 months. Ideally, actually after 6 months, it would be best.
How long after subfascial implants does
Yeah.
it take to drop and fluff? And also,
Right.
how long before swelling and bloat goes away after the procedure?
That's a great question, and I'm glad you asked that because I did a I don't know, a story, a reel, a TikTok on what my preferred approach for breast augmentation is nowadays, and I was talking about the subfascial approach, and I think there was a little bit of confusion because some people are confusing this subfascial approach with just your standard under, above the muscle under the breast approach, which is called the subglandular. That's the subglandular approach, which is the old school way. And people were saying like, oh, you don't know what you're talking about. Everyone says it has to be beneath the muscle because subglandular has been shown to have increased rates of capsular contracture. Well, the second part is correct. Yes, subglandular has shown to have increased rates of capsular contracture, but that's not one of the newest, most modern techniques of doing a breast augmentation, okay? But I've been doing this for about 2 years now, and it is my preferred approach. So what does that mean? It means that there's a layer on top of the muscle called the fascia, and now with the newer techniques, we're able to get in between that layer, so between the muscle and the fascia, create the pocket there, and that way the actual muscle stays down, but then the implant is covered with the fascia, and then of course the breast on top of that, and so the capsular contracture rates are still very, very low. They're as low as when you go underneath the muscle. But at the same time, you're not going to have an animation deformity. So when you move around, the implant doesn't jump up. And at the same time, you're not cutting or destroying muscle as well. All the function of the muscle is preserved. So this is by far my preferred approach because it is the best of all worlds, okay? And it is, yes, a newer and more advanced technique, okay? Now, how does it take for the implants to settle? I still say it takes about a full 3 months. Though honestly, I think that they settle a bit quicker than when you place the implant beneath the muscle. The other thing I've noticed with our patients is that they have less pain, right? You're not cutting through the muscle, you're not sticking an implant in a place where there's typically not any volume underneath there. So because of the fact that you're not cutting and lifting or destroying the muscle, overall the patients have less pain, and so they get back to work and regular lives a lot quicker. And also, I think the question also asked about inflammation. So yeah, typically less inflammation when you're going subfascial as opposed to beneath the muscle.
Yeah, the question was, how long does the bloat go away after the procedure? So the next question, let's see, we have a lot.
Okay,
Doctor, how do you
answer a lot?
Prevent, I think it says thrombosis, but I think how do you prevent thrombosis?
Great question. So one of the things that we worry about with pretty much any procedure, especially any procedure that we do under general anesthesia, is the risk for blood clots. And so another, the technical term for that is thrombosis, okay? And so thrombosis is blood clots. And this is something that we always want to fight and minimize the risk as much as possible. Now, are we ever going to get it down to 0%? No, right? Just like anything in surgery or in medicine, nothing is 0% or 100%, but we can get it down to like very, very low, and I'm talking like 1% or less risk, okay? And so how do we do that? So I like to do a couple things routinely pretty much for all my patients. So the first one is to use a device for the legs, which is called a sequential compression device, SCD. And so what that device does is it keeps the circulation moving in the lower extremity, and that decreases the risk of blood clots. Specifically a blood clot called a DVT or deep vein thrombosis, okay? And that's one of the things that we do. I have all my patients use this device for the first 2 weeks after surgery. And if they are coming from out of town, I definitely make sure that they're using the device on the plane when they head back home, and then they continue using the device for at least another week after arriving back home. The second thing that we do pretty standard for all our patients is make sure that they are being active. So my expectation is that all patients are walking at least 10 minutes every hour while awake. All right? So 10 minutes every hour while awake. And then the last thing that we can do, which is not routine, but say I think I have a little bit of a longer case, like a trifecta perfecta, that's where we combine the arms, the breast, and the tummy. Or say that the patient's BMI is a little bit on the higher side, like at the 30 or maybe just a bit past 30. for very specific patients, I may then also add a blood thinner called Lovenox. And so that is an injection that the patient does. It's a blood thinner, and they'll do that starting the day of surgery and continue it on for at least 1 more week.
How soon can you return to work typically after Lipo 360?
So that's a great question. Well, the first thing I'm going to ask, well, what type of work do you do, right? But let me put it this way. For most patients, especially in an office type setting, you can usually go back to work in about a week. Yeah, so it's fairly quick after Lipo 360. Now, remember, you're going to go back to work, but you're still going to have you're going to have your compression garment, right? Your faja with your foams and your boards. You have to wear kind of like loose clothing and things like that. So some considerations. But for most patients, office type setting, you can go back in a week. Now, if you have a job that requires heavy lifting or strenuous activity, so maybe some of our nurses, our firefighters, our police men or women, well then you're probably gonna have to wait the full 6 weeks.
Dr. Earle, what disqualifies you for surgery like blood work?
Okay, so what are some of the things that we may see on your labs that will then not make you a candidate for surgery? Okay, well, one of the things that we always look at is what's called your hemo level, hemoglobin hemo level, okay? So the hemo level is very important, okay, because we want to make sure that it's an adequate start place, because we're always going to lose some degree of blood with any procedure, right? And remember, these are totally elective outpatient procedures done in an office-based surgery setting, okay? So the hemoglobin level for me has to be more than or equal to 12, okay? So especially when we're talking about a Lipo 360 or BBL, or a bigger case also like a Mami Makeover, okay? Now, if you're doing just a very kind of short, simple, straightforward case, say for example, just a breast case, so what's a breast aug, breast reduction, whatever, just a breast case, then I can go down, I don't mind, hemoglobins are 11 or so for the breast cases, okay? But for pretty much anything else, it needs to be 12 or above. So that's definitely one of the things that we look at. Another thing that may disqualify you is, how long it takes for you to basically to clot. So we check a factor there, it's called PT-INR and PTT. These are part of your blood test. And if those are elevated, it means that you don't clot very quickly, right? So you have a tendency to bleed. And so if you have that, if those numbers are off, then we've got to see what's going on. Because of course we don't want someone on the OR table that has a tendency to bleed beyond what is normal, okay? If your pregnancy is positive, then of course you're out. And then this is not necessarily a blood lab, but we do check your urine. And so if the urine is positive for, like I said, pregnancy or nicotine or drugs, then you're gonna be, disqualified for surgery as well.
Thank you. Is it normal to get back acne after lipo/lymphatic massage?
I've seen it, but it's not, I don't think necessarily due to the lipo itself. I think it's due to the fajas usually. The fajas plus minus the foams or the boards. And so especially if you're in a little bit of a warmer climate or a humid climate, when you have that faja on, with plus minus the foams and the boards, and it's hot, right, and it's humid, and you're still wearing it, night and day, like we asked you to do in the first 6 weeks, sometimes that can then lead to some back acne. What I can tell you though, the good news is that it's temporary. So once you decrease the time in the faja, usually after 6 weeks, you can go to 12 hours a day, and then after 3 months, you can stop the faja altogether. Usually that result goes away.
Thank you. Do you recommend someone getting as slim as they can before surgery, before their skinny BBL surgery?
So in general, I want you to be at your ideal weight, okay, at the time of surgery, right? What I don't want is for people to undergo surgery, and really any surgery, and then lose a significant amount of weight, okay? Because everything that we've done to all the shaping, the tightening, everything that we've done at the time of surgery, if you lose 20 plus pounds afterwards, well, things are going to change, the skin's going to get loose again, and you're just not going to have the same result, right? So it's better for you to kind of get to your ideal weight, the weight that you think that you're happy with or you're going to be able to maintain for a long, long time, so that result that I give you for at the time of surgery can last a long time as well.
Thank you. For small implants, is it necessary to do a T-cut?
No. So the T-cut, okay, so the T-cut doesn't necessarily have to do anything to do with the implant. That's if you need a lift or not. So she's talking about, sometimes we call it the T-cut, sometimes we call it that anchor type pattern. So that's the breast, that's kind of the anchor type pattern that we're talking about. So that is only necessary if you have a droopy, okay, what we call breastosis or a droopy breast, and you need a lift. And it's also not every breast that's if you have very mild droopiness or ptosis, then you typically don't need this anchor or T pattern. But if you have moderate to severe droopiness, then you will need that pattern. And that can be whether you have a small implant or large implant. Really, it depends on the case, right? But yeah, it's more about the droopiness of the breast than it is about the size of the implant.
I've already had a previous reduction without implants. Is it possible to reduce the size further?
It is possible. You have to go to someone who has a lot of experience doing that. They'll go to some, the first guy you meet out there, because it is technically more challenging. Because remember, every time that you do a breast lift or reduction, you are removing some blood supply to the areola and nipple area, okay? And so the more times that you do that, the higher the risk then that you may end up with what's called nipple necrosis, or the skin of the nipple dying, right? Basically turning black and falling off, and we don't want to do that. So each subsequent surgery becomes a bit more challenging, but for someone who has a lot of experience like myself, I know what to do technically to try to preserve as much blood supply to the nipple area as possible, and decreasing that risk of nipple necrosis. Now again, like what did I say before? In plastic surgery, nothing is 0%, right? So there's always a risk there, but you want to try to minimize that risk as much as possible. But the short answer is yes, you can do it again.
Hi Doc, you gave me a BBL in 2021.
All right.
And it was the best decision of my life.
Awesome.
Just a comment.
Yes, thank you so much. I love the shout outs. Please keep them coming.
Do higher than normal liver enzymes disqualify you for lipo BBL?
Not necessarily, okay. I think we have to look into it, right? And so we would ask your primary care doctor, what they believe is going on. If they're just slightly elevated, sometimes people just have that and nothing else is really wrong, and the liver is really actually functioning okay. And so for that particular, if that's the reason, then we can go ahead and proceed with the surgery. However, if they're really off, then that there definitely means there's something wrong with the liver, something bad is happening. And so we have to then communicate with your primary care doctor. They have to figure out, the actual diagnosis, what is going on. Is it something that is temporary and can be reversed, or is it something that's, more major? And just gotta take it from there.
Can you do a tummy tuck and breast lift at the same time?
Definitely. So tummy tuck and breast lift is part of what we commonly call a Mami Makeover, okay? So the Mami Makeover is a combination of a breast surgery and a tummy tuck. That breast surgery can be any breast surgery. So it can be a breast aug, a breast lift with or without implants, and or a breast reduction, okay? So that combination of a breast surgery and a tummy tuck is your Mami Makeover. Super, super common. We do it here pretty much every single day. And just because that's the name of it doesn't mean that you have to be a mommy to get it done, right? So you can be just, for example, someone who lost a lot of weight. So especially like if you've been on the Ozempics and Manjaros, right? So that's super popular these days. It's a great way to lose weight. But what happens when you lose a ton of weight is that then the skin becomes loose, the breast might become droopy, things of that nature. So you can have your quote-unquote mommy makeover, even though you may not be an actual mommy, right? We're just combining a breast procedure and a tummy tuck.
Can you fix fibrosis?
So, yes and no, right? It depends on the degree of the fibrosis, okay? So let me backtrack a little bit. The first thing we want to do is prevent fibrosis, right? So how do you try to prevent fibrosis? Well, there's some things that are from the surgeon's point of view, and some things or responsibility, and some things are from the patient's responsibility, okay? What can the surgeon do? The surgeon cannot be overly aggressive. And by overly aggressive, I mean you shouldn't like thin out the skin so much, okay? You always want to leave a layer of about 1 centimeter fat underneath the skin throughout, because the thinner the skin, the more aggressive you are with, the higher the chance of fibrosis, okay? So from the surgeon's point of view, you don't want to be overly aggressive. From the patient's point of view though, they have to be super compliant after surgery, because one of the ways to minimize the risk of fibrosis is to do your post-op lymphatic massages, and of course your compression, all right, and staying very well hydrated. So post-op lymphatic massages, you're going to need a minimum of 20. All right, your compression, you're going to wear 6 weeks, night and day, and then an additional 6 weeks, 12 hours a day. And I expect all my patients to drink about 1 gallon of fluid a day. All right, 1 gallon of fluid, about 4 liters of fluid a day. And all those things are going to help minimize or decrease the risk of fibrosis. Now, once you've developed fibrosis, and it's been a year, because within the first year you can do other treatments also with the massage. You can do wood therapy, carboxy treatments. There's all sorts of other treatments that you can do. But it's been now say it's been past a year. You tried everything else. You still have some fibrosis. Well, then that sometimes we can treat in the operating room with the use of the vaser. Okay, so the vaser is that device that I've been talking about that uses ultrasound energy, okay, that helps break up some of the tissues and some of fibrosis and helps smooth things out. So that is also a possibility. Now, having said all that, if you have very severe fibrosis, because maybe you've had multiple rounds or things like that, a lot of times that's very tough to treat, and you may not be able to treat it at all.
What is the range for electrolytes in your hemoglobin?
So, all right, so in your lab test, you mean. So hemoglobin is one of the tests that's typically included within what's called a CBC, or a complete blood count. And as part of the CBC, one of the things you're going to have there is your hemo level. Very important. Another lab test you're going to do is going to be either what's called a BMP, or basic metabolic profile, or a CMP, which is a complete metabolic profile, all right? And that's going to have several electrolytes on there. So we're going to be measuring your sodium, your potassium, your chloride, your bicarb, okay? So all sorts of things there. And so yeah, all of those should be what's called, quote unquote, within normal limits. And so whenever you get the labs, of course, they're going to give you your result. There's one column that's going to say your result. The other column is going to say what's the normal range. And of course, your result has to be within the normal range.
Can you do a lipo in BBL if you have HTLV1 virus?
HTLV1 virus, can you do a lipo BBL? Yes. For the most part, yes, that shouldn't be a problem.
Thank you very much. Let me see.
And by the way, because just, not necessarily related to that, but a question that comes up often is, can you do lipo BBL or really a procedure if you have HIV? And the answer to that is yes, as long as the HIV is under control, meaning that you have normal white cell counts and that your viral load is undetectable, which these are lab tests that we can do. So if you do those labs and they check out, meaning that all your counts are within normal limits and your viral load is undetectable, then we can go ahead and do surgery as well.
When can I stop using compression socks after the Mami Makeover?
So I typically recommend that my patients use their compression socks for 1 week, okay? But remember what I talked about before about the thrombosis? That device that I'm gonna give you, that sequential compression device, that we have to wear for 2 weeks.
Why after a BBL is there sometimes revisions? How often is the revisions after a BBL?
Great question. So revisions are something that can happen after a BBL, okay? And if you look at the national data, by national data I mean, throughout the US, okay, the typical revision rate after a BBL is somewhere between 10 to 15%, okay? Our revision rate for pure plastic surgery is a little bit lower, but certainly not zero. It's about, well, depending on the year, it's about 5 to 6%, okay? And so why is the revision rate for a BBL going to be in that range? Well, because a lot of factors in a BBL. that neither the surgeon and sometimes not even the patient can control. And so what are those factors? So you're gonna be like the quality of the fat survival rate, the quality of the skin, whether the patient was compliant with their post-op care, where they went to the right massage therapist, where they wore the right faja. Whether they fed the fat, right? If they lost a ton of weight maybe in the first 3 months. All these things can affect the result. And these are outside of the surgeon's control. Some things are outside even the patient's control. Genetics, what quality of your skin. There's nothing you can do about that, right? You can make it worse, right? If you smoke, what about if you smoked after surgery, right? That's another thing. So smoking can make it worse, sun damage can make it worse, and things like that. But once you get to surgery, the quality of your skin, there's nothing you can do about that, right? So because of all those external factors, we may then have to go back and touch up a little area here or a little area there. What's the great news now, though, is that you guys have probably heard me talking about this stuff that we have called alloclay. So alloclay is structural off-the-shelf fat. So now it's just fat that I can grab off the shelf. I can put it into certain areas to fix small areas, small dents and bumps here, something that may require 25 cc's, 50 cc's, up to 100 cc's. And so I can do that now I don't have to do a whole other procedure, like a whole other liposuction procedure. Because this can be done in the clinic setting, under local, you're in, you're out, you're back to your normal life with minimal downtime. So that's really, really exciting, especially when we're just trying to fix a small area.
Do you do a plasma for patients who don't want a tummy tuck?
All right. If you actually need a tummy tuck, nothing else is gonna do that for you. Okay. And what I mean by that, if you have moderate to severe loose skin, if you have muscle separation or muscle weakness. So if you have any of these three things, there's no amount of J plasma or body tight or Vaser that's gonna do what a tummy tuck's gonna do. Okay, and the bottom line is you just need that tummy tuck. And my recommendation is always to do your tummy tuck first. So come in, do your tummy tuck, fix the skin, fix the muscles, then come back 3 to 4 months later and do your BBL. Okay? Now, if your muscles are pretty good, your muscles are fairly strong, they're not separated, and you only have mild loose skin, then yes, in those particular patients, adding something that will help the skin retract is helpful. And so you can add things like J plasma or body tight, but my favorite is Vaser, which I use for all of my Lipo 360 and BBL cases.
Thank you. I know you covered this a little bit ago, but we just have more questions on it. So if you could briefly answer again, what can get you denied for surgery in regards to blood work?
All right, so so what can get you denied for surgery? Let's say in regards to the clearances that we do before surgery. Real quick, so we'll go rapid fire here. Okay, hemoglobin level too low. Your blood clotting levels are basically too high, right? So your PT, INR, and PTT are too high, meaning that you have a tendency to bleed. Okay, positive pregnancy test, positive nicotine test, positive drug test. Okay, and of course an EKG. So we check the heart, right? An EKG that's abnormal. Or not getting cleared by your primary care doctor. So those are all things that would potentially either have to be worked on or cause you to have a cancellation in your surgery.
Can I combine breast lift, Lipo 360, and a BBL? And if yes, how do I sleep?
No. So I don't like to combine a breast surgery with your BBL, okay? And there's a few reasons for that. Some of them are particular to Florida. But I think overall, it's just like you just said, a very, very tough recovery. Like, how are you supposed to sleep, right? Because if you do a breast surgery, you're not supposed to sleep on your breast, on your tummy. And if you do a BBL, you're not supposed to sleep on, you're not supposed to sleep on your back, and you're supposed to avoid any pressure to the buttock and hip areas, okay? So it makes the recovery very, very tough. It increases the potential complication rates, potential rates of bleeding, potential rates of blood clots. All those go up when you combine all those procedures, okay? And then specific to Florida, when you're here in Florida, we do have a rule by the Florida Department of Health which states that if you are doing a surgery where you make an incision, such as a breast lift, then you're limited to removing only 1,000 cc's of fat via liposuction, right? So now you're greatly limited as to how much fat you can remove, which is limited as to how much fat you can put back in. And so generally that's not going to give you the BBL result that you like, okay? So my recommendation is to separate those procedures. So do, you can do your, in this particular case, you can either way around. You can do your breast procedure first and then your BBL, or you can do your BBL and then your breast procedure. But if we're talking about combining a tummy tuck with Lipo360 and BBL, then again, you want to separate those out. And in that particular case, I highly, highly recommend do your tummy tuck first, and then come back after 3 months, 3 months or later, to do your Lipo360 BBL.
Thank you. Do we have time for one more? We're over 30 minutes. We have to go soon.
All right. We're gonna do what? One more or a couple more rapid fire?
Let's do it. Yeah.
All right. Here, rapid fire round. Let's go.
Can you include aloclay with my BBL if I don't have enough fat to fill in the hip dips?
Yeah, that would be a possibility. So you're like a very thin patient, right? Your BMI is very, very low. We can try to get whatever fat that we can. Maybe use that fat to actually give you the projection, and then use the aloclay to fill in the hip dips. So it is a possibility.
How do you know if the abdominal muscles are separated?
So you can actually sometimes feel that. A lot of times just through a physical exam. Like if you put your hands right here and you feel like the two kind of bulges, which are your muscles, and like an empty space almost in between, that means that your muscles are separated. Also, if you kind of push your muscles out, sometimes you can see like a space in here that's sometimes in and then all of a sudden bulges out. That means the muscles are separated and you have a diastasis or muscle separation. If it really bulges out and you can feel like some of the organs from the inside, then you may even have a hernia, and that's something that definitely needs to be taken care of.
Let's see. Okay, rapid fire. Let's go.
All right.
Let's see. So this is just another comment showing love. I had my surgery yesterday.
Oh.
I'm doing amazing. What a great doctor. Amazing staff.
Oh.
Thank you. What a blessing to have Dr. Earle and his team. Thank you.
So nice for you to come. I hope you're recovering well, and I'll see you soon for your post-op day 5 appointment.
Have you done a BBL on a patient who's had scoliosis surgery with Harrington rods in?
I have, yeah, and so that's definitely, it's definitely doable. All right, that's number one. I mean, I have to be careful, right? I have to make sure that I know where your scars are, where everything is, that I can be careful. But yeah, it's definitely something that can be done.
All right, so last question. Will you do a BBL on a patient who's had sculptura in the buttocks? Also, what treatment is best for cellulite dents after BBL?
Great questions. Okay, so we'll end with that, but here we go. So, can you do a BBL with sculptura? Yes, sculptura is actually one of the things that I'm okay with to do a BBL afterwards. So sculptura is okay, and the hyaluronic acid. So if whatever you put in there is hyaluronic acid, from whatever brand, then that's okay too. Okay. What I don't do is BBLs after someone who's had biopolymers or whether it's medical grade or industrial grade silicone place. So biopolymers and silicone, not a candidate. Okay. Sculptura, you're okay. And then the other question was what to do for cellulite. This is a great question. I haven't talked about it in a little while, but we have a device called Ovally. It is a great device for cellulite. It's actually the only thing out there that actually works for cellulite, which is a little device that goes in and cuts the bands that create the divot or the dimple of the cellulite. Okay. So what actually causes cellulite? What causes cellulite are these septate or bands that pull the skin down, and they attach the skin to the underlying muscle and they pull it down, creating that divot or dimple. So if you have this Ovally device, you go in and you cut those bands, it releases the skin, and so the skin can then cut up and smooth out. Okay? The great thing about this Ovally device is, again, it can be done in the clinic setting, under local, minimum downtime, you're back to life. Just like that. Okay?
Thank you very much.
All right, everybody. So today we kicked it old school. I think it was good. There was a ton of questions.
So many more.
So we got through a whole bunch. But if I wasn't able to answer your question, of course, you can always shoot us a DM. You can always go to our YouTube channel, Pure Surgery on YouTube. All our lives from the past 5 or 6 years or more, 7 years, are there. So pretty much any question you can think of has been answered, and you can look it up on our YouTube channel. But otherwise, I look forward to seeing you all